지금까지 충격파 치료만으로도 좋은 효과가 있었는데 여기에 EMTT가 국내에 도입되어 병행치료를 하게 되면 환자와 치료사 모두 만족할 수 있는 치료법으로 자리 잡을 수 있을 것으로 생각됩니다. 카스텐 선생님도 동의하시는지요?
So in the early 2000s, 2003, 2005, I started my Achilles tendon research. And at that point of time, I started to treat high-level athletes in soccer and others. And for example, a painful Achilles tendon at that point of time was treated with eccentric training, optimized loading, maybe shockwave, maybe topical nitroglycerin, and so on. The issue was that at that point of time, every treatment was done separately, time after time. So in a professional athlete with Achilles tendon pain, this meant that he was treated 3 months with eccentric training, then proceeded maybe to nitroglycerin, then proceeding to injections and so on. So it took very long time. And one of my first ideas of how to overcome these issues is to combine treatments early and simultaneously to offer faster return to play. This was one of my ideas 20 years ago. When I started my practice in Hanover in 2012, 11 years ago, one of the major concepts is faster healing, better. So we achieve healing with shockwaves alone, which takes a certain amount of time depending on the turnover of the tissue. A tendon cell divides every 2 months, a skin cell every week. So the tissue turnover is different. However, if you apply different modalities, say shockwave, say EMTT, maybe lasers of a certain amount, maybe some injections, you might speed up the healing tremendously. And this is what I see. And we will see in the future trials, hopefully clinical trials in athletes as well, showing that the return to playtime for ankle sprains, for muscle injuries, for Achilles tendinopathies will be faster, although still safe to do the sports. So that's what I foresee. But we will have to wait for more data on this. But this is my observation.
충격파 치료와 EMTT를 병합하여 치료하면 EMTT가 근골격계 분야 외에도 여러 방면으로 적용 범위를 넓혀가는 연구가 지속되고 있습니다. 향후 특별히 주목받을 분야는 무엇이라고 생각하십니까?
Very good question again. So if we stay in a moment for the MSK in the orthopedic field, and this holds true for shockwave and this holds true for EMTT as well, we have good data for tendons, for bone, and less for muscles, but nearly no data, beneficial data on ligament healing. So ankle sprains, which is common, ACL injuries are common, and the effects of shockwave on these indications has not been elucidated quite good, and the same holds true for the EMTT. So MSK-wise, I would love to see data on ligament healing. If it comes to different fields, I mentioned that it appears to me, based on case series, that there is a beneficial effect of EMTT on nerves. So the best studied yet is carpal tunnel. So it might be worth to see whether or not EMTT plus shockwave is better than shockwave alone in carpal tunnel syndrome, for example. And the beauty of the EMTT is that the penetration is quite deep, so 20 centimeters. So you might even reach nerves which are very deep, even the spine nerves, for example. So in my vision, there might be very good data maybe on spine issues like disc prolapse, facet joint, osteoarthritis, and so on, where we see even positive effects for focal shockwave. So this might be in spine area a nice indication. We have some observations on PEMF, that PEMF is very effective even on the lymphatics. So it appears to increase the outflow of lymphatics. So why should the EMTT not be helpful in the lymphatics as well? And this will support my observation that in ankle sprains, for example, the swelling is reducing much faster. If it comes to, say, the pelvic area, from a urology point of view, chronic pelvic pain syndrome is a huge indication for focused shockwave. And there are competitors in the field with PEMF devices applying PEMF to the pelvic floor to overcome muscle problems in the pelvic area, both in males and in females. So even in the OB-GYN area, there might be the effect, and we see 2-3 papers even for focused shockwave in the OB-GYN field in the moment. So I foresee that maybe EMTT, because of the non-invasiveness and because of the no-touch technique, might be very beneficial, especially in the pelvic area for both males and females, because you don't have to disclose yourself. You can treat with the closed zone. So these are fields, and as you know, I'm trained, and I wrote the book on plastic shockwaves in plastic and aesthetic surgery. So in the moment, I'm not sure, and Uzi asked me already whether or not EMTT is working good for skin. I simply don't know in the moment. So I would not exclude that on the one hand, even faster healing in wounds, or in burn wounds, for example, or in chronic wounds, and even some effects on the skin itself, or even on wrinkles might happen. So the box is open. We have experience now. This machine is 3 years old. So we have 43 years of experience with shockwave, 3 years with EMTT. So there's a lot of work before us to be done and to be know much more.